Hi, in this lecture, we are going to continue our study of the heart by looking at the pacemaker cells, which you previously learned, and focusing in on the conduction system of the heart. So the conduction system of the heart is kind of like the electrical wiring I referred to earlier. And the conduction system is the small piece, right, less than 1% of the heart, that contains these pacemaker cells. And then we're going to look at the ECG or EKG because it's measuring the electrical activity of the heart, which is generated by these cells. Now, the first thing I wanted to do was a real quick overview. You guys have seen lots of different animations in these lectures and you have a lot of resources. So just a real quick update. Remember, you have this Unit 1 helpful links. So this is right in the Unit 1 folder. Every unit has this folder and I am always updating it. And I just put online animations, tutorials, anything that seems helpful for the unit. If you find cool online resources, send me the information, send me the link so I can put it in there. And I really do want you to take about 45 minutes to an hour every week. Just sit down, have a snack, click it, and watch the videos. The other tool that you have is mastering, and I'd like you also to have a study block just dedicated to mastering. You can go in and study by chapter if you want, that's fine, but there's a couple places that I want you to go for the heart. So when you click and you go in the study area, you'll see the animations and videos. When you click that, you'll see a whole bunch of choices. Go to big picture animations, and there's two here that I think might be helpful for you. Okay, fix that spelling. The other resource that is really good is this interactive physiology. And this is where I'm going to take some stuff to show you today in lecture. And I really think it would help you a lot if you go there. So I'm going to go there and just show you what you have there. So I'm in the study area and I can click on any of these items, but I'm going to make sure that I come down to my interactive physiology. And notice when I click that, there's all sorts of cool things. Now, if you forgot muscle phys, go watch those animations. Maybe you forgot the neuron, the action potential, it's all there. We are focusing on cardiovascular, and it does a really nice job. You can go through the pathway of blood through the heart. You can see the action potentials. Today, I'm focused on the intrinsic conduction system, and notice that there's a lot of these animations to help you in the next few lectures as we delve into cardiovascular physiology. So let's jump right in. We have the cardiac conducting system. It's the tissue you see here in yellow. So it kind of looks like wires. These are the pacemaker cells. Remember, they're found in very specific areas of the heart, and each area has a name. Now there's a whole collection of them up here in the right atrium, the superior portion of the right atrium. It's called the sinoatrial node, but we say SA node. There's another little cluster here. This is called the atrioventricular node or the AV node. You'll notice it's right behind the tricuspid valve. So a lot of this is up in the right atrium. And then you'll see these yellow lines kind of coming down from the SA node to the AV node. Those are called internodal pathways because they travel between nodes. Now, the information always goes one direction only, and you'll see in a minute that the SA node typically starts this electrical, action potential. And then it sends it through these pathways. Notice one comes over to the left atrium, the rest go to the AV node. And then you'll see one of these wires coming out of the AV node. That's called the AV bundle. Sometimes you'll hear it called bundle of His. And then notice that splits, and we're going to have a right bundle branch going up into the right ventricle, and we have a left bundle branch, which is the pacemaker cells that are going to the left ventricle. And then there's branches that come off that go right into that myocardium, and these are called Purkinje fibers. So this is the name, this is the anatomy of the conducting zone. Now, let's start looking at the physiology of this. So we know that any of this, anything you see in yellow that I just mentioned can depolarize all on its own. Remember, they don't need to be told what to do. But the SA node, that one's always first, right? That's always got to be the first one. It's the fastest, and it basically forms action potentials pretty regularly between 80 and 100 per minute, just opening, opening, opening. Remember, the pacemaker cells are going to depolarize when which ion enters? and you should have said calcium. So they form that action potential, and now that wave of electricity is going to shoot through all of these cells because they're all connected. Now the SA node is controlled or innervated by the autonomic nervous system. It does not need the nervous system to depolarize. It does use the nervous system to speed up or slow down. And like I said, any of these areas, these pacemaker cells can depolarize all on their own. It's supposed to be the SA node because it's the first one, it's the fastest one, and it sets the pace, it's called the pacemaker, for the heart. But anywhere in here could depolarize, and when it does, we'll see an arrhythmia. And we will talk about arrhythmias in lab. Now, the SA node is called the pacemaker because it sets the heart rhythm. It sets the depolarization rate. Remember, it actually depolarizes 80 to 100 times per minute, but our resting heart rate is not 80 to 100 beats per minute. Our resting heart rate, the textbook average, is 72 beats per minute is what a lot of times people will say. So take your heart rate when you're sitting. Actually, the best time to do it is first thing in the morning, and it should be between 60 and 80 beats per minute. It does get information from the vagus nerve and the cardiac nerves. So you should remember the vagus nerve, cranial nerve number 10, and the vagus nerve is the brakes. It's going to slow down the heart rate. And in fact, the vagus nerve is always active on the SA node. Do you remember the neurotransmitter it releases? Hopefully you said acetylcholine. So what we have is our heart has something called vagal tone. Now we're going to come back to that later, but vagal tone means that the vagus nerve is constantly innervating it. It's always releasing acetylcholine to keep it a little bit slower. So if I cut that vagus nerve, it's not going to go abnormally high. It's just going to go up to 80 to 100 beats per minute, right? Because that's where it wants to be. And the vagus nerve is like, slow down. So that's what the vagus nerve does. So the vagus nerve is the parasympathetic division. Remember that the autonomic nervous system has the parasympathetic and the sympathetic. So the cardiac nerves is coming from your sympathetic. You might remember the chain ganglia there for the sympathetic. So that's carrying sympathetic information. And when that goes over to the AV node, it's going to speed it up. So the SA node depolarizes, starts that action potential, and then that shoots through like electricity through the wires. It comes over to the left atrium and it goes right through the right atrium to the AV node. So it travels through these internodal pathways until we end up at the AV node. Now remember, as this wave of electricity is passing, this is a depolarization wave. So it's depolarizing the cells in that area. This is an electrical event. When it gets to the AV node, it actually stops. It's delayed for 1/10 of a second. So you might wonder, well, why would it be delayed? Well, there's two reasons, really. One is it takes a little bit longer for the impulse to come over here to the left atrium, right? We want both atria to depolarize at the same time. They will depolarize and repolarize as a unit. Now, after they depolarize, they will then contract. Just like skeletal muscle, you had to depolarize it first. You learned about that latent phase. Then, a short while after, the myosin grabbed the actin and you had the contraction. It's the same thing here. So we have to depolarize first. Then shortly after the atria, both of them are depolarized. Then they will actually contract and squeeze the blood out. So you have a delay here to make sure the left atrium and the right atrium depolarize together, and there's a little extra delay to make sure that they can start contracting and squeezing blood in the ventricles before we come down and depolarize the ventricles. So once we depolarize the atria, now we're coming down this bundle, and then it splits. We have the right bundle branch that's going to the right ventricle, and the left bundle branch taking that action potential to the left ventricle. And then it shoots into these little fibers called Purkinje fibers, and they innervate the myocardium, the cardiac muscle of the ventricles, and they also innervate the papillary muscles. So remember that these structures are going to depolarize, and after they depolarize, they will contract. So we can measure the activity of pacemaker cells on an ECG, an electrocardiogram. Sometimes it's called an EKG, the K for the German K, but it's the same thing. And what an ECG is you put these electrodes on the body. They look like sticky pads, and it picks up the electrical activity in the heart. Now, before I show you the electrical activity, I want to show you this real short animation showing you the movement of that action potential through the conduction system.
The SA node initiates the depolarization impulse, which in turn generates an action potential that spreads throughout the atria to the AV node. Here, the impulse is delayed briefly before continuing on to the ventricles through the AV bundle branches, and Purkinje fibers. Action potentials, which spread from the autorhythmic cells to the contractile cells, are electrical events. The subsequent contraction of the contractile cells is a mechanical event that causes a heartbeat.
So as that action potential travels through the pacemaker cells, we can pick it up on an ECG. Now, when you look at an ECG, you'll notice it looks kind of like graph paper because this paper is very specific. We'll talk about it in lab because we can measure time and we can measure height, which is really important. But what we're going to look at is just the anatomy of an EKG. And you'll notice that, I know you've seen these before, but it has these waves. So first of all, anytime you see a flat line, right? A flat line is called asystole, and that means there is no electrical activity. So obviously that's not good, but notice if you look at an EKG, there are periods of time where there's no electrical activity, and we'll go over that, but I'm saying that there's nothing. And before you freak out that your patient is dead, just make sure that you powered it up and you hooked it up properly. So we know that the very first thing that happens is that that impulse is going to go from the SA node to the AV node. And as it does that, we know it depolarizes the atria, and so we get a deflection. So any deflection up or down means electrical activity, and you can see that here. And so our first wave on an ECG is called a P wave. And that is showing us when that impulse goes through the atria and the atria depolarize. Then we're going to have a short period of time where we have a flat line. Well, remember, when we have the flat line, the impulse is technically in the AV node. So that piece should be about 1/10 of a second long because it's waiting, right? It's hanging out. Now I'm going to keep going for a second. Once it goes to the AV node, then we know it goes down the AV bundle. And then from the AV bundle, let me get another color, it's going to go through the bundle branches. And then once it travels through the bundle branches, it then is going to go down into the Purkinje fibers. So this giant complex here is called the QRS complex. I'll just write it here. And so notice that the QRS complex is going to show you the entire time the ventricles are depolarizing because we're going down the AV bundle, the bundle branches, right? So we're in there, and it's big because the ventricles are much bigger than the atria. And so there's going to be more mass to depolarize. Now the area I drew in green is actually the PR segment. And the PR segment is when it's in the AV node. We're not doing the PR interval, just the segment. So that represents when the impulse is in the AV node. So it's from the end of the P wave and the beginning of this Q. Let me draw it like this real quick. So if we're looking at the QRS, technically that first little depression is the Q, although you typically don't have one. And then we have the R wave. The R wave is the top. They're really easy to see. And then we are going to have our S down there. So we have our QRS complex. And so the PR segment is from the P to the beginning of the R wave. So it comes right across because the Q wave, if it's there, will drop off a little bit. Then we have our QRS complex, which is when our ventricles depolarize. And now we just need the ventricles to repolarize. And that's going to happen in the last wave, which looks like this, which is called the T wave. Now, understand that during the QRS is when the atria are repolarizing or resetting. So this is showing us the events that occur. in the conducting zone as that impulse passes through. So again, I'll try to sync it up. We know that our impulse goes from the SA node, right? And it goes down to the AV node. And when that happens, we have our P wave. The atria are depolarizing. And then the impulse gets to the AV node. And it hangs out in the AV node. So this is my PR segment. From there, I might not be using the exact same colors I just used. It goes down the AV bundle. There's the Q. Then it will go through my bundle branches. So remember, I have a right and a left. So it comes up like this. And then the next thing is it goes into the Purkinje fibers, where it's going to actually innervate my myocardium. So that's why I have my QRS complex, where it's going through the ventricles. And then the very last event to occur is when my ventricles are going to repolarize, and that's my T wave. So what it does is it syncs up perfectly with what's happening in the heart. And so we can look at an EKG and we can get information about the conducting system. We can see the electrical activity of the heart. So I'm going to come back to that interactive physiology next, and so you can see it.
We see heart electrical activity reflected in an ECG wave tracing. The P wave represents atrial depolarization. The QRS complex represents ventricular depolarization, and the T wave represents ventricular repolarization. Please note that in a normal ECG wave tracing, atrial repolarization is hidden by the QRS complex. These diagrams show the correlation between heart electrical activity and an ECG wave tracing. The P wave represents atrial depolarization, which is followed by atrial contraction. The QRS complex represents ventricular depolarization, which is followed by ventricular contraction, and the T wave represents ventricular repolarization, which is followed by ventricular relaxation.
So it might be helpful to go into interactive physiology and play that for yourself. And the last thing I want to show you is just a typical EKG. And notice, again, we'll do it in lab, and I will try to blow this up over here. So what we would want to do is be able to label it. So notice that we start and we see our P wave, and then we have Q, R, S, T. So these are all R waves. They're very easy to see. They're the ones that stick up high. And the P waves are also pretty easy to see. They always happen before the R, right? And then you can see the T. So this is called normal sinus rhythm. Everything's going the way it should happen. You can see your little flat, right? Your little PR segment there. And this is what we're looking at when we look at an ECG. So if we know what a normal one looks like, then we can look for abnormal ones, right? Anything that's different in the pattern, and that's how we can pick up disease.